I am Community Clo of Urban One Stations, and I am truly honored. And you know, I believe in going to the source for you. This is the month of July. And did you know that July is Uterine Fibroids Awareness Month? And joining me, he's back on the show. Now, this is the first time we got it right to do it in July. We usually do it months ahead or months later. I want to introduce him to you, formally introduce you. Well, I am honored again to be here. Dr. McLaurin is a board certified and fellowship trained interventional radiologist who joined Radiology Associates of Richmond in 2014 and now serves as the chief of vascular and interventional radiology. Now, before we get started, I got a quick question for you.
Yes, ma'am.
Why uterine fibroids?
Why uterine fibroids?
Yes.
That's a great question. Well, you know, as an interventional radiologist, I am trained to do minimally invasive procedures all over the body, essentially, to treat a variety of disease processes. However, over the years, I've been asked to treat many patients for complications related to hysterectomies, which are a primary treatment for uterine fibroids. And when I saw multiple patients who had these complications that I was being involved in to treat and to fix, it was pretty upsetting to me to know that I had something better to offer them.
Instead of just taking a whole box out.
Exactly.
I said that, he didn't.
I did not say that. But yeah, so I knew that I had something better to offer, and I felt compelled and obligated to get the word out, and it has become my mission since then to just work on increasing awareness in our community about uterine fibroids and all of the potential treatments that patients can have.
You said something interesting last year. What exactly is interventional radiology?
So interventional radiology is a specialty of radiology where we use imaging techniques like ultrasound, X-ray, CT scans to perform minimally invasive image-guided procedures. So these are often procedures that are replacing the need for open surgery. So nowadays it's, 10, 20 years ago, if you were to go having to have open surgery, nowadays we're able to treat the same diseases through a small pinhole in the skin through just a needle puncture.
A needle puncture and no surgery.
No surgery.
This is good stuff. So for folks who are just joining us this month, is Uterine Fibroid Awareness Month. Uterine fibroids are extremely common, but unfortunately, many women who suffer from fibroids do not know about all of their options for treatment, and that's why we're here today. So I have more questions for you because it was so interesting to understand why in the world, when you're talking about something which occurs mostly in African American women, what are some uterine fibroids and what kind of symptoms have you seen with your patients that occur? Sure.
So let's start with what fibroids are. So fibroids are tumors of the uterus. They're the most common tumor of the uterus. In fact, they are benign. They are not cancer, and they can occur anywhere in the uterus. They can be present for many years. Patients can be unaware that they're there. They can just grow silently and not cause any problems.
But also while you're pregnant too.
Exactly. They can get larger during pregnancy because of increasing hormone levels. In fact, most women with fibroids are asymptomatic, meaning they don't have symptoms. But depending on their size and location, they can result in a number of symptoms. The most common symptom is heavy menstrual bleeding. And then the next most common types of symptoms are the symptoms related to the bulk of the fibroids. The fibroids can grow so large that they can actually press on adjacent organs like the bladder and cause urinary frequency or difficulty in urination. It can cause constipation by pressing on the colon. They can even get so large that they press on the nerves in the pelvis and cause leg pain, leg cramps, even low back pain. Right, and they can even cause issues with infertility, pain with intercourse, and also anemia.
Serious, huh?
Very serious.
But can be taken care of.
They can be.
Okay.
Absolutely.
Who's at risk for developing fibroids?
Well, the truth is, all women are at risk. Any woman with a uterus is at risk for developing fibroids, and in fact, about up to 70 to 80% of women by the age of 50 will have fibroids. It's true. It is true, unfortunately. But when symptoms do occur, they occur in about 25% of women. Only about a quarter of patients with fibroids will have symptoms. And the symptoms usually occur during childbearing years. So on average, I would say most of my patients are in their 30s and 40s. We don't know what causes fibroids exactly. We think...
Is the research still out on this?
Correct. We're still working on trying to define the exact cause. We suspect that there are a combination of genetic as well as environmental factors that contribute to their development, but we don't know exactly. And I'm sure that there are different factors for different patients as well. But we do know that fibroids are associated with obesity because we know that fibroid growth is encouraged by estrogen. So our estrogen hormone, as it goes up every month during our menstrual cycle, that encourages fibroids to grow. Also, estrogen is stored in our fat cells in our body, so obesity can be associated. The more fat cells you have, the more estrogen you have. So,
Dr. McLaurin, what is considered obesity?
An elevated BMI level. So that.
What about the big boned black girl?
Well, I won't get into that, but yeah, big bone can sometimes be used as a
BMI.
Yes, exactly.
I'm just putting you on.
You're putting me on the spot here.
What do you wish women knew about optional treatments for fibroids?
Well, that's a good question. So, a lot of times fibroids are diagnosed in the gynecology office, by doing an ultrasound during pregnancy or what have you. And so oftentimes patients are only introduced to options that gynecologists can offer. The main treatments that they'll offer are hormonal therapy like birth control pills, intrauterine devices like IUDs. Then, of course, gynecologists are surgeons, so they'll offer surgery. The number one surgery, the number one intervention that is performed for fibroids in this country actually is hysterectomy.
Yeah.
600,000 hysterectomies are performed in this country on an annual basis.
600,000?
And over half of them, or about half of them, are performed for benign reasons, including fibroids. So they'll talk about hysterectomy and myomectomy. Myomectomy is where it's still an open surgery, and they can go in and actually remove individual fibroids from the uterus. And so that's usually what people are aware of. But nowadays there are minimally invasive treatment options, and the one that I perform as an interventional radiologist is something called uterine fibroid embolization, or UFE.
Yeah.
And that is a procedure that it's done outpatient. There's no incision, which means less risk. Also shorter recovery time. All the fibroids are treated at once, and best of all, the uterus is preserved. There's no removing of the uterus.
This is interesting. And for more information, how do our viewers contact you or Richmond Vascular Center?
Sure, they can find us easily at richmondfibroids.com or richmondvascularcenter.com. And we have our phone number. It's 804-864-8346.
Now, this is another question, because I'm always like, whenever I'm speaking to you, I'm like, Dr. McLaurin, how do you describe uterine fibroid embolization to your patients?
Sure. So embolization, let's just start with what the term embolization means, because that sounds like a crazy...
I'm acting like I know all about embolization.
That's great. Well, let's get you straight. So embolization is just the term that refers to blocking something up. And in this case, what we're blocking up actually is the vital blood flow to the fibroids. By cutting off the blood flow to the fibroids, then over time they will shrink and the symptoms will get better. So the way we do the embolization is through an outpatient procedure. So there's no hospital stay, and we only have to give our patients a light sedative, so there's no general anesthesia required either. Then we use ultrasound to place a small catheter, which is basically a long plastic tube about the size of a spaghetti noodle, into the artery either here in the wrist.
Are you going to be sedated
Yes,
during
ma'am.
this process?
Yes.
I just wanted to make sure.
Yes, absolutely. Yes, our patients are very comfortable.
Okay.
We make sure they're very comfortable, and most patients nap through the procedures, and most people don't even remember them.
Yeah.
So, but we put this catheter, long plastic tube, into the artery either here in the wrist or here at the top part of the thigh. And then using live x-ray imaging, we then guide that catheter into the arteries that supply blood to the fibroids. And then we use these microscopic beads, these small particles that are then delivered into the arteries that then lodge into the arteries deep into the fibroids. It slows and eventually stops the blood flow to them. The catheter is then removed, and then the patients recover here for about an hour, and then they go home and recover the rest of the time at home. And then over time, their symptoms get better, and they have a complete 180 in their quality of life.
So you're one of the answers
Yes, ma'am.
to all of the hysterectomies all over the nation.
Not all the hysterectomies, and
But I
surgery
mean-
is still needed, yes.
I mean, in some instances,
Correct.
surgery is needed.
Absolutely.
But there are treatment options,
Yes,
okay?
exactly.
And so I think this is a better option if it's available
Yeah,
for you.
that's right.
Now, for women, I know we're talking about childbearing ages for women between the ages of 30 and 40. What about the woman at 50? Do you think it's still good for her to get the surgery, or just say, hey, I'm beyond childbearing years, should I get the hysterectomy?
That's a great question. Right. So after 50 years old, you're creeping a little towards menopause. Some people earlier than others, and some people later than others. Some people in their 60s still haven't hit menopause. But for most of the time, if you can get into menopause, then the heavy bleeding will stop, and the symptoms of fibroids should get better on their own. And also there can be other things that can cause heavy bleeding later in life that need to be investigated to make sure that we're dealing with what we think we're dealing with, and it's not something else. But yes, I've had several patients that are in their 50s still dealing with heavy periods, still dealing with fibroid symptoms, and have yet to start getting into the symptoms of menopause. So, in those patients, we've had very good success with them as well.
Wow. And we want to meet some of those patients really soon and hear their real stories.
Absolutely.
Dr.
'Cause
McLaurin.
I can talk all day
I
about
know.
this, but to get the real story, I think you need to talk with my patients.
Yes, we're going to do just that. Now that we heard from the great Dr. McLaurin, we want to speak to a few of his patients to get the real story. We're about to sit down, as we're already seated with some of the patients, to talk about their journey. I want to introduce everybody to Tori Johnson. How you doing, Tori?
I'm good. How are you, Clovia?
I'm good. Tori is currently employed with the Chesterfield Mental Health Services. She enjoys speaking time and spending time with family, traveling, listening to music, and is extremely passionate about helping individuals with their mental health challenges. Go on, girl. Talani Carter, how you doing?
Well, how are you?
Talani is a full-time entrepreneur and owner of T. Chanel's Travel and Events, a home-based travel agency. Girl, I gotta get with you. She enjoys traveling the world and helping others enhance their travel experience. Welcome.
Thank you.
And Richara, your daddy name Richard, I know your daddy name is Richard. Richara Shepherdson Turner is a school social worker, qualified mental health professional, and therapist. All right, so now we're going to delve into this conversation. It is necessary. It is so important. But before we get started, ladies, we got to talk about some numbers. So, Richara, what's your number?
21 days.
21 days.
Yes. 21
days of a cycle.
Of a cycle.
All right.
Non-stop.
Non-stop. Tori, your number.
3 months.
3 months, non-stop of a cycle.
Yes.
All right, Talani.
30 days.
30 days cycling.
Cycle.
And we're not talking motorcycles or bicycles. I just want to let y'all know. And for me, it's not about me, but 12 months nonstop. And for the folks who are watching us, who are thinking, I don't want to see a doctor about this, I can handle this, look, you need to come over to Richmond Vascular Center. All right, so first of all, we're going to start with you, Richard. What was the most challenging symptom you endured because of your fibroids?
I would say the low energy.
because of the consistent bleeding, the energy level was just low. So then when I would show up, to work or just working with other people, I just didn't have that energy. And I wanted to have that because I am a pretty energetic person.
Right.
I work out, just love to have fun. And my cycle was so heavy, so consistent, 30 days, 21 days, and it was inconsistent as far as how long it would last.
Right.
So for me, it was just a lack of energy. Like I would have to crawl out of the bed, and I had to go to work. I had to do what I needed to do, but it was very difficult.
Wow. I had some friends who were on their cycle for like 3 days. I'm done. And I'm like, what? Heavy bleeding? Nothing. Just look. And you're thinking about what in the world is going on.
Yeah.
At this time. So what did you decide to do about it?
So I was given options that I definitely was not considering. Of course, the hysterectomy, even a partial.
Right.
And I was like, well, why would I want to get a hysterectomy to put myself into menopause? Or like that was the first thought. Like, first of all, who wants to go through menopause? Right. So why would I eat? And then they're like, oh, you can do hormones and you'll be. And I'm like, no. So those were some of the treatments, options that they gave me. And no one ever told me about uterine fibroid embolization.
Really?
That came from research, and it also came from just talking to women that were experiencing the same thing I was experiencing.
So how did you come to Richmond Vascular Center?
So let me just tell you. So my school that I work for is on the south side. And I was on Midlothian, and there was a sign. It was a billboard, and it talked about uterine fibroid embolization. And it was a black woman on the board. So, it caught my attention.
Catchy, guys.
It caught my attention because I was like, oh, okay. And because of the fear that I had with just going through any procedure, my husband was like, well, just you need to call. Just call. Because he understood what I was going through. And I'm not going to say he was tired, but he was overwhelmed with what I was going through.
Of course he was.
Because that's like my best friend. Okay? So he's very overwhelmed. But seeing that billboard, it just kind of it felt like I was in the right place at the right time. I was like, oh, that's a sign. And I called.
Wow. And today, so you have the uterine fibroid embolization, and what was your recovery time like?
Listen, I think he told me, Dr. Lawerence stated that it would be like 10 days.
Really?
Yeah, he said 10 days. He told me to take off for 10 days, or, you could put it, take time for 10 days. Honestly, 5 days was enough.
Really?
I just decided to take the 10 days.
Well, I mean,
because, I'm like, I'm 21
and 30 days.
We're
talking cycles, not bicycles and motorcycles, okay? All right, you're talking that red cycle.
Yeah. But wow. It was good. I think because they prepped us so much in the beginning with different medications to just kind of ease whatever you would feel, and then if you follow the regimen to a T, you're gonna be okay.
Isn't he so good? He explains everything. What intervention or radiology and why fibroids and why not? Okay.
Yes.
All right, Tori. So, how did fibroids affect your day-to-day life and activities?
Heavy bleeding during my periods, which, like you said, it caused low energy.
Yeah.
So I didn't have the energy to do anything. But I later found out that my mood swings were related to fibroids.
I was amazed.
And I was up and down from day to day. One day I'm up, the next day I'm down.
It's going to how heavy the flow was.
Right. But no, this was just any day.
Oh, my.
Any day.
Got heavy. The attitude was heavy.
Yeah, any day. I'm up one day and I'm down. And honestly, I thought that, I'm asking myself questions like, do I need to go see a mental health specialist?
Honey.
Okay.
Yeah.
And you are the mental health specialist, right?
After 3 months of non-stop bleeding.
Yeah. So that and the pelvic pressure.
Ooh.
Because I did have one fibroid that was the size of an orange.
Really?
Yeah. And the pressure in my pelvic.
Wow.
Yeah.
So, how did you get over here to Richmond Vascular?
Well, I had heard about the UFE years ago, but it was not like a common practice.
Yeah.
It was like in Atlanta, I think at that time when I heard about it. And actually I was listening to the radio, 104.7 one night.
Yeah, I'm glad it was one of our radio.
I was listening to 104.7 one night and I heard the infomercial. And that's how I learned about Richmond Vascular. I called them that Monday and they set an appointment. I came in.
Wow.
Yes.
And you're satisfied, I see.
I'm happy.
You don't seem like you have the mood swings.
Not at
Rocks
all.
over here.
Not at all.
Wow. And Talani.
Yes.
Oh my goodness. So you did a straight 30 days,
Yes.
non-stop cycling.
Yes. During the month of
Please.
my wedding.
So wow, he really proved his love to you. He didn't even leave you at the altar.
He didn't.
Really?
Yeah.
You promised him, you said we're gonna get this thing fixed.
Yeah, it was, the pain for me was the worst.
Okay.
And I've been having heavy and painful periods since 12.
Wonder why we didn't do anything about it earlier. Is it just us as Black women?
I don't know. I guess for me, I was thinking about it like nobody really tells you about periods. Like you just think like this is what it's supposed to be. It's supposed to be painful. It's supposed to be heavy.
Yeah.
Just make sure you're prepared. But nobody says like, okay, well, this amount of heaviness may be, you may need to get checked out for this. So yeah, nobody. I had no idea. I just thought it was normal. I thought everybody went through the same thing that I went
30
through.
days at a time of
Yeah.
a cycle.
Yeah.
And so that was something that you really weren't sharing with your friends anymore.
No.
You've been on your cycle. It was like they're going to come on again and you still on.
Yeah. Yes, and it was like the menstrual changes too. So for me, like the 30 days, that happened maybe twice in a year. But but after that, it was like maybe 7 days, and maybe 9 days, maybe 5.
Yes.
It never really got less than 5. But
dang, you didn't catch that 5 during the wedding.
I know that's what was and honeymoon. It was all everything, the whole month.
Thank God for Richmond Vascular Center and
Yes,
Dr.
thank
McLaurin.
God. Yeah, seriously, thank God.
So how did you arrive here?
So, I didn't even find out that I had fibroids until I was pregnant with my youngest son.
Okay.
And before that, I had been talking to doctors like, okay, listen, this pain, is there something I can do? And they're like, oh, you're fine. basically like, girl, you'll be all right. You a woman, you got it. So when I found out with my youngest son, when I was pregnant, my doctor said, hey, you have fibroids, but everything's okay. Everything, we'll take a look at it after. But that doctor ended up actually leaving the state. She moved to Texas afterwards. Okay. So I got other doctors, and I'm like, can somebody check on them? Because now I'm nervous. I'm like, well, what's a fibroid? I'm thinking, I'm ready to die. So what's going on? And then she's gone. So. The follow-up doctors was like, oh, you're fine. Everything looks great, da-da. So finally, I was in a little group on Facebook and people were talking about having Black OBGYNs. And I'm like, you know what? I think I really need to do that because not anything against any other race, but I just felt like my concerns really were not being heard. And I knew something was not right. So finally, I found Dr. Bazile, and literally she was like a godsend. The first day I went in there, she asked me about fibroids. And I'm like, yes, I have them. Can we check on them? And literally my next appointment, she checked the size. And then she recommended me to Dr. McLaurin. And
Did she?
Yeah, she was like, she said, she gave me my options, of course.
Right.
But she said, if this is something that you're interested in, this is the, guy who did mine. She showed me her little scar on her wrist, and we
talked.
Put some cocoa. Listen, and it's so small, I forget what it's from. So she's the one who recommends. She's like, I have the perfect person for you. Wow. And she set up an appointment. I came here. I'm telling you, it's just been amazing.
Dr. McLaurin is so sweet.
He is. He really, really. And every time I come here, I'm like cheesing. I'm just like, oh my God.
I put him on the spot. And I was like, yeah, you got options instead of taking out the box. You said. Knock him out the box, Rick. We're not doing it. We're going to hold what we got.
You're right. Yes. Yep. And so he gave me the options and the rest is history.
Wow. So these are real stories from satisfied patients after their uterine fibroid embolization, UFE, here at Richmond Vascular Center. And we have all of the information on the screen. And if you're going through, you're having some symptoms, heavy periods, painful periods, pains everywhere. Am I talking like I had experience? There's pain shooting out nowhere. Then all of a sudden you get a cycle out of nowhere, right? You're like, okay, I'm good, I can breathe, and then you get another cycle. I'm telling you. So you need to call Dr. McLaurin over here at Richmond Vascular Center. So. Wow. So would you recommend, and I know this is kind of like a crazy question, all questions are great questions. Would you recommend Richmond Vascular Center to your friends?
I have. I've been in Facebook groups. People have been asking about, fibroids or what should they do, OBGYN. I have literally been screaming it from the rooftop, like, let me tell you about this thing. I went here and I had this, so yes, definitely.
Right.
Definitely.
So you wouldn't, prior to meeting Dr. McLaurin, did you have discussions about your fibroids with your friends? Was that something you didn't talk about often?
I didn't talk. When I found out I had them, I talked to, select few, my aunt, my husband, select
Why do
few
we feel
people.
do we feel like we're less of a woman or something? Or
Yes, I don't know. I guess I really didn't understand what it was. Like I heard about it before, but I didn't really understand what it was, where it comes from. So I just was like, okay, I got them. Let me pray. Pray them away. I don't know.
Let me starve myself. Maybe there's shrink. I tried everything. Didn't work.
Right. Yeah, I don't know.
I think this is good, because when you're dealing with a situation like this, whether it comes to your family or your friends, it's something that we don't want to talk about. First of all, it's below the belt, okay? And we get really sensitive when it becomes something about below the belt. But just talking to Dr. McLaurin, it's like we're sitting here having a conversation about fibroids that's up in the uterus, right? And he's making it just as simple as possible. So we want to encourage all folks who are watching us today, and you're having painful cycles, or you're just having issues and you're not sure, just reach out to Richmond Vascular Center. So I want to thank you, Talani, Connor, Richara, and Tori for being a part of this meaningful conversation. God bless you, and health and wealth up, baby.